Does the PAD revascularization procedure hurt?
The PAD revascularization procedure that we do to open up the arteries in the legs and restore blood flow does not hurt. Let me explain that a little bit. First of all, it's not surgery in the traditional sense. There's not a large incision. We don't cut through a lot of muscle. You don't need general anesthesia. It's a minimally invasive image-guided procedure. It's a lot of words and a lot of syllables. Allow me to elaborate. All we make is one small hole in the groin, and that's where we enter the femoral artery. By that point, you'll have already had an IV with conscious sedation, so you're sedated, you're asleep, you don't feel anything. In addition to that, we'll use some local anesthesia, some lidocaine in your groin area, so you won't feel that either. So everything we do will be through that small hole inside the artery, from the inside. And we're going to be watching what we're doing with fluoroscopy, which is like real-time x-ray, and ultrasound. So we can see what we're doing without making a large incision, without making multiple holes and putting in a camera. Just one small hole about the size of a pencil diameter, or maybe even a little bit smaller. So because of this, it's minimally invasive. You get conscious sedation in an IV where you're asleep and you don't feel anything, and lidocaine in your groin. The procedure generally doesn't hurt at all. In fact, most people don't feel anything. I've seen many patients after procedure and they say, that's it, we're done? And indeed, they are done. The only thing I'd say is sometimes after the procedure, you might have a little soreness in your groin. Just like when you get a shot in your arm, it's sore for a day or two. Sometimes there's a mild soreness in the groin from where we entered the artery, but it's generally not severe by any means. It's generally maybe a 1 out of 10 sort of pain, and that doesn't last very long. So the PAD revascularization procedure we do is minimally invasive through a small hole in the groin, not a surgery in the traditional sense, not a long recovery, not a lot of pain, either little, very little to no pain. So if you're a candidate and you have peripheral arterial disease and you need those leg arteries opened up, or you have wounds that aren't healing on your legs, or you have leg pain and you don't have an explanation for it, give us a call, let us evaluate you. First, we're going to evaluate you, look at your arteries, do an ultrasound, talk to you, get your history. And if we determine that you have peripheral arterial disease and you're a good candidate for our procedure, then we'll go ahead and schedule for the procedure, open up those leg arteries, and hopefully alleviate your symptoms.